Hi.
I'm Dr. Kumar, and I got your result, your ultrasound result there, and it shows that you have a DVD on your left leg.
Okay.
Do you know what DVD is?
No, I'm not sure.
So what DVD is basically a blood clot to your extremity, the left leg, and sometimes it happens when you travel for too long, or obesity, or physical inactivity. Have you been doing anything recently?
I actually was on a plane for a few hours.
Oh, okay. So maybe that could be a reason too. So in future, if you're in plane, just try to walk around, get some circulation then.
Okay.
Okay. And so what I'm gonna do, I'm gonna discontinue your heparin and start you on Coumadin.
Okay.
And so what Coumadin is basically a blood thinner. It's gonna make your blood thin, and hopefully it can thin out the clot you have, and it prevents the blood clot from growing bigger.
Okay.
I want you to come to labs every week because I want to monitor your INR.
What's an IR?
What INR is basically going to tell me how effective the Coumadin is on you, and it's going to tell me how thick and thin your blood is. So depending on your INR result, I'm gonna change the dosage if I have to.
That makes sense.
Okay. Do you have any question?
I don't think so.
Okay.
You good?
No, I'm okay.
Okay. So this medication therapy is gonna be for 3 months, and if you have any question, you can call me back. And I think you're ready to go home, so I'm gonna discharge you.
Okay. It's just pills, right? It's not
Yeah.
shots or anything
No,
like
it's not. It's not a shot. It's a pill that you have to take orally. You just have to go to lab weekly and then get your INR drawn.
that? Sounds good.
Okay. Good. Okay. So I'm gonna let your nurse know that you're ready to go home, and then she'll come and discharge you. Okay.
Perfect. Thank you.
You're welcome.
How are you feeling?
Okay.
Yeah.
Hi, how are you guys?
Good.
Good. How are you?
Good. I'm Diana. I'll be your guys' nurse for today. Can I check your ID badge?
Sure.
And what's your name and your birthday?
Leah Fitzgerald, 42785.
And no allergies?
Nope.
Okay, great. Well, I'm here to explain the new medication you'll be taking, Coumadin. Do you know a bit about that?
Not really.
Okay. Well, when you came to the hospital, your ultrasound came positive for a DVT on your left lower leg, which is a blood clot. And the Coumadin is going to prevent it from further clotting and traveling to the rest of your body.
Oh my gosh. Is there any complications?
Well, we want to avoid it traveling to the lungs because it can that's called a pulmonary embolism, and it can cause respiratory distress.
Sounds good.
Yeah. So are there any things that we need to be aware of while she's on this medication?
Well, she definitely needs to monitor for signs of bruising or bleeding. Dark stools could be a sign of blood in the stool or bleeding in the GI possibly. You also want to use a soft toothbrush to avoid any bleeding in the gums.
Okay.
And you want to elevate your legs when you're in bed and don't sit for long periods of time.
That makes sense.
So are there anything else that we need to be aware of?
Well, I brought this brochure on Coumadin foods. I brought this brochure of foods that she needs to avoid while she's on Coumadin.
Okay. Thank you. Now, I like to eat salads on a daily basis, so is that something that I should be concerned about?
Well, unfortunately, green leafy vegetables do have a high amount of vitamin K, which works against Coumadin because vitamin K clots while the Coumadin is trying to declot, so it kind of works against each other. So just try to eat that in moderation. Yeah. Do you have any more questions regarding this medication?
I don't think so.
Just remember that if you skip a dose, you just don't want to do a double dose. You just want to
Take it the next day. Okay. So just to clarify, I should call my doctor if there's any signs and symptoms of bleeding, right? To make a follow-up appointment for INRs in a week.
Yes.
And then to eat salads in moderation, not daily.
Correct.
Okay.
Okay, well, if you guys don't have any further questions, I'll get your discharge prepared.
Okay.
Okay,
Thank you so
bye.
much.
It's not ready.
I'm like, hold on.
Thank you so much.